Hey everyone, for this episode of Evidence of Greatness, I'm going to look at a new study that just recently came out that's called The Effectiveness of Solution-Focused Brief Therapy, an umbrella review of systematic reviews and meta-analyses. So what this study is going to do is it's going to look at several different systematic reviews and several meta-analyses that have been done on solution-focused brief therapy. And now they're going to pull all of this research together. And they're going to, in essence, tell us what the overall findings of various studies are. So this is going to be one of the first kind of major reviews of solution-focused brief therapy. And we're going to look at like what's available across basically the world. So the first thing that we're going to do is look at the literature review. They talk about how in the literature review, previous research has said that there's been positive effects of solution-focused brief therapy. We know that. There's lots of research that says that solution-focused brief therapy works. And then on average, it takes about 4 to 6 sessions, or the research that's been done has been on sessions that range from 4 to 6. Then they go into a little bit of the purpose, like why do an umbrella review? And one of the things that it does is it tries to investigate if consistency in findings are met. Basically, they're looking for, when studies ask the same research questions, do they get the same results? It also is going to point out if there's any discrepancies in the research. So basically, they're going to look at the systematic reviews and the meta-analyses and say, are they finding similar things, or are they finding things that are contradictory to each other? Some of the things in the literature review that they talked about as far as positive outcomes is that we know that there have been findings that show that SFBT is effective with different age groups. We know that it's effective in different various fields. We know that in different cultures it's been done and used. We know that lots of the findings have said when there are fewer sessions, again, kind of this 4 to 6 range, then that would make it more cost effective. And then also they highlight this finding that says, when you do this work, there's lower risk of burnout. So that in and of itself, I think, is something worth highlighting. That SFBT works. It works with lots of different groups, lots of different presenting problems, but it also happens in few sessions, which means it's cost effective. And people who do this work tend not to get burned out as much, which I think is really, really valuable. So the research questions that they went into this with were, for what types of clients and what issues is the effectiveness of SFBT well established? So who does it work with, and how well does it work? In addition, how much reliability do we find? How consistent are these findings across measures? And then finally, what factors like therapy settings are found to moderate the effectiveness? Basically, they want to know, like, are there some areas, some presenting problems, some demographics that SFBT works with better? And if so, are there things that we could do to increase the effectiveness or the inconsistencies in the results? So the method, one of the things that they start with when you're going to do a meta-analysis is you do this extensive literature search. You're looking for every single study you can possibly find. And so they did a search in 5 different databases in the electronic databases to say what research is out there. They also looked at the SFBTA list and the EBTA list, and then they did a Google search. So they're trying to make this search as broad as possible. And then one of the things that they did is that they then went through all of the studies and they did a quality check. And they did the check on basically using this grader measure. And they're looking at, were there any limitations? What was the methodological quality? Are these good studies? Second, they're looking at the directness, or what are the outcome measures being evaluated? What are the direct impacts on the other variables that are being shown there? So in essence, they're going to say, does SFBT directly impact the independent variables? So things like depression, anxiety, those kinds of things. So does solution-focused brief therapy impact the other variables? Third, they're looking at consistency. Are all of the studies in these meta-analyses, are they pointing in the same direction? In essence, are the findings consistent across the various studies that are included? And then four, what's the degree of certainty of the findings? So how confident? So we're going to talk a lot about confidence intervals. We're going to look at like how confident we are in these findings. And then do they report bias? So again, they took lots of different meta-analyses, lots of different systematic reviews, and they evaluated each one of those on these 5 criteria to say how well are these studies designed, how rigorous are these studies, how good are these studies. And so they're looking at, like, when we take all of this research, are we getting good research? So then that increases our confidence in the findings that we've got. So in the results, they came up with the various meta-analyses, and they did the, and in the initial broad search, they got 2,080 articles. They then looked at the abstracts and the titles, and they whittled it down to see which ones were relevant, and they came to 131. In those 131, they did full text reading, so they read the entire articles to say, is it relevant? They came up with 16 systematic reviews that fit the criteria. Then as they did the manual search through all of the other literature and they looked at the other databases and those kinds of things, they added 6 more. And then when they did the Google search, they added 3 more. So total, they came up with 25 systematic reviews. So they included 25 different studies. Then you have to remember a systematic review, each systematic review is made up of a bunch of smaller studies that they took. So that's what they called principal studies, the number of principal studies. In the 25 systematic reviews, there were 71 principal studies. And some of those studies were used in the various different systematic reviews. So they were cited 224 times, where 51% of the total citations came from these principal studies. And then also what they looked at is how many of the studies overlapped from one systematic review to another. And they found that there was a 24% overlap of citations. So one of the things that helps us to understand is that the systematic reviews, in essence, there was about 75% that were unique studies that were out there in different places, but there were about 25% where they were evaluated in more than one systematic review. So that kind of helps us to understand, like, where is this research being cited? Then again, looking at the quality of these things, they scored an indicated of 20% were low and 80% were critically low in the confidence of these systematic reviews. So basically, when they evaluated the systematic reviews, they said there's some concerns. Each one of them had at least one major flaw. Now, this sounds worse than it is, because when you're doing research, in essence, you can't control for everything. You can't know everything. And so when you hear these critical flaws, then you'll be able to understand that a little. Most of the systematic reviews failed to list and justify why they excluded some studies. So in essence, they just didn't have the information. They just didn't present the information. So it's not that they didn't exclude studies for a good reason. They just didn't explain why they excluded them. Many didn't include a risk of bias in the study. So one of the things when you do a meta-analysis or a systematic review is you're supposed to evaluate how much bias is there. Do the researchers, are they SFBT researchers, and so they're hopefully going to find bias? Are they excluding or including things that they're not supposed to? So it wasn't as common as systematic reviews have developed over time. They're starting to include this risk of bias more and more and more. So some of these studies occurred before that was kind of common practice, but lots of them didn't include this risk of bias. That doesn't mean that they are biased. It just means that they didn't evaluate it. And then third, among the meta-analyses, there were 15 total included. 11 did not include separate pools for randomized and non-randomized studies. So basically that means when they did their data analysis, they didn't separate randomized and non-randomized studies and said, does it make a difference, the quality of the research? So again, this doesn't necessarily say that the quality of research is bad. It just means that they didn't demonstrate or show an evaluation of that. So again, the critically low and the low ratings, it doesn't mean that they necessarily are poor. It just means that we need to do a better job when we're doing research of demonstrating these things, of being really transparent about how we're getting the findings that we're getting. And that will increase the validity of our research. So for any of you out there who are doing research, it's helpful to know this because we want to know, like, why are you excluding certain studies? What is the risk of bias? Can you randomize and non-randomize and do different samples for those so that we can evaluate? So this just gives researchers some idea of how to increase the validity of their research. So then some of the other results here that are important. Most of the systematic reviews were concerned with children and adolescents. So that means there's lots of research out there about children and adolescents. There's less out there about adults. 13 of the studies were with westernized populations, and the rest were with Eastern populations. And there were very, very few that looked at the global population, some samples from Western and Eastern populations. So again, that's one of the things that this study is doing. The other studies aren't doing is that they're looking at both Western and Eastern studies. In addition, they show that school settings are one of the most commonly studied areas, which makes sense since a lot of these studies are about children and adolescents. But what this also tells us is that we need to do other research in other domains and other areas. Interestingly, group therapy was the predominant methodology in Eastern studies, places like China, Iran, Turkey, and only about 42 to 64% of Western studies were group format. The rest were individual. So this is something really different about the way that Eastern studies are designed versus Western studies. Eastern studies tend to deliver solution-focused brief therapy as the intervention to a group. Now, that's not necessarily bad. It just says we know that a group format works, but we don't know much about individuals or couples or family settings. So again, what we need to do more of is individual, family, couples research and test, is it as effective in other non-group settings? Usually the results were small effect sizes in Western studies and larger effect sizes in Eastern studies. Now there's several reasons for this. Usually Eastern studies are using what they call passive control groups. So this is like no treatment. So they're comparing people who don't get therapy to people who do get therapy. Or they're giving people just a treatment as usual. Maybe they're at the doctor and they're just giving them the regular drugs that they would normally give, and then they're giving another group therapy. So that's what they call a passive control group. And Eastern studies tend to do more active control groups where they're saying, okay, we're going to compare solution-focused brief therapy to cognitive behavioral therapy. So when you compare it to another form of therapy, the effectiveness tends to go down, or the overall effect tends to go down. This doesn't mean that solution-focused brief therapy isn't effective. It just means that it's not super more effective than what you're comparing it to. Whereas when you compare it to no therapy, they're finding, oh, when you get solution-focused therapy, it's really effective compared to no therapy. So again, you're seeing larger effect sizes in Eastern studies, but it tends often to be that they use passive control groups or that they use no treatment control groups. And so that might help explain a little bit of that difference. But also when you take Eastern and Western studies and you put them together, they show a moderate effect size. So in essence, that makes sense. If you give large effect sizes and small effect sizes, and then you put them together and you say, how effective is solution-focused brief therapy? You're going to get moderately effective, which again, when you compare it to other forms of therapy, that's actually quite good. So that tells us a little bit about, again, one of the questions was, what are the similarities and the differences between regional studies? And this is helping us to understand, oh, there's differences in the way that the studies are designed. There's differences in the way that what populations they're working with. Predominantly children, adolescents, predominantly in school settings. That helps us to know we want to bulk up research in some other areas. In addition, I think this one is really interesting. There were no significant moderations found in gender, socioeconomic status, therapist experience, therapy duration, primary study design or publication status, the number of participants in a group. So in essence, what that means is solution-focused brief therapy is similarly effective, regardless of if you're working with men or women or non-binary individuals. It's the same whether you're working with wealthy or not wealthy. It's the same. So in all of these different categories, they're saying there really wasn't a difference. We couldn't tell that these different factors changed the outcomes. So solution-focused brief therapy is similarly effective across these various groups. One of the things that's also interesting is the overall number of sessions didn't seem to make a difference either. Whether you got 1, whether you got 20, didn't really seem to make a difference. However, that was different in groups. In groups, they kind of found this sweet spot of 6 to 10 sessions. If you got more than that, then the effectiveness started to decline a bit. So again, if you're going to do group work, this might help you inform the design of your group. 6 to 10 sessions is probably a good sweet spot. Then they divided the rest of the results down into what do we know about different populations, adults versus children. In adult populations, one of the things that they discovered is that we have high confidence in the effectiveness of solution-focused brief therapy in internalizing issues. This is things like depression, anxiety, things that are happening, the way that I'm modulating things inside of me, internally. And what we found is that solution-focused brief therapy is effective, and we can have a lot of confidence in that. There's enough data to say, without question, solution-focused brief therapy is helpful with these types of cases. Then if you go down to the next one, it says effectiveness was established mainly in comparison to other therapeutic approaches such as psychodynamic or CBT in Western principle studies, where it was established in no treatment in Eastern studies. So again, this is just kind of a mirroring of what we said before. But one of the things I think is really interesting about this is that it's saying we have high confidence that solution-focused brief therapy works with internalizing issues, even when we compare it to things like psychodynamic and CBT. So it is as effective or even more effective than other forms of therapy. But we only know that in Westernized studies, and we need more of those studies in Eastern regions to figure out, do we find similar results in the Eastern areas? They also go on to say that we have a high confidence in the effectiveness of progression toward goals. So in essence, it says, are people getting better? Are they moving toward where they want to go? And they say, yes, they do. And in fact, we're really, really confident that they do and that it works consistently. And then there's moderate confidence in the effectiveness on social issues and externalizing behaviors. So again, with more studies, that will very likely move into the high confidence region. But right now, moderate confidence, which again is still good. Basically, it's saying it's still effective, and we're really sure, we're moderately sure that it's consistent each time. So these are good results. Basically, what this is saying is solution-focused brief therapy works with adult populations really, really well. For children and adolescents, there's a small to moderate effect in Western populations, but a large effect in Eastern populations. Now, again, this is probably due to study design. Overall, there's moderate confidence that SFBT is effective in each of these areas, in internalizing and externalizing factors, in social issues, in self-esteem and self-worth, social issues, medical issues, coping and cognitive aspects, hope, individual goals. So in essence, they're saying there's a lot of evidence that we can be pretty sure is effective every time when they're dealing with children and adolescents. However, there's less confidence when it comes down to harming themselves. And this might be to drugs and alcohol, this might be to self-harm, those kinds of things. And really, the thing is, we just don't have enough studies. So we don't know if it works. Solution-focused brief therapy works for children and adolescents in this area. So we might need more studies to look into this. So then here are kind of the major takeaways. Solution-focused brief therapy was more effective than no treatment and waitlist. And it had similar or better than treatment as usual and other treatments, well, things like psychodynamic and CBT, regardless of, and this is really significant, age, issue, culture, or setting. So what this first bullet point says is that solution-focused brief therapy works really, really well. It works as well as psychodynamic or CBT or other modes of therapy, regardless of age, culture, whatever issue they're coming with. So this is a strong statement to say solution-focused brief therapy is effective. Typically, like we've mentioned before, they have larger effects in the Eastern studies than in the Western studies. And we need to bulk up the quality of research in Eastern regions, and we need more research across the board. That will help with this. The umbrella review, basically this study, found that there was no difference in confidence in the evidence by world region. So in essence, it doesn't matter if it's coming from Western or Eastern studies. It shows that solution-focused brief therapy is effective and that we can be really confident in its effectiveness across the globe. So this, I think, is also a really important thing, because when people are asking, does solution-focused brief therapy work with this problem or with this group of people or whatever, this study is basically saying, yes, it works, and it works consistently, and it works well, and it works just as well or even better than other types of therapy. So that fourth bullet point says the confidence in the evidence of solution-focused brief therapy's effectiveness mainly reached the moderate level, suggesting that more studies overall are needed. If we want to get to that high level of confidence, all we need to do is continue to do research, continue to do high quality research, report things that we definitely need in there so that we can get a high rating on these various measures. And then finally, it says if SFBTU is used in combination with other approaches, controlled studies are recommended to evaluate the effectiveness against pure solution-focused brief therapy. So if I'm going to mix solution-focused brief therapy with anything else, if I'm going to do cognitive behavioral and solution-focused, if I'm going to do solution-focused and narrative, then they're saying, in essence, this research doesn't apply to those combinations. This research is simply about this pure form of solution-focused brief therapy. If you want to know about the effectiveness of a combination, you're going to have to do a controlled study. And the way that you have to do that controlled study is you have to give some people the pure solution-focused. And then you have to give some people the combination. And you have to say, which one works better? How do they compare against each other? Because right now there's very little, if any, research that looks at combination approaches. And so that's, I think, a real takeaway when oftentimes we get asked the question, can you use solution focus with insert other approach? And the reality is, sure, you can use it, but you'll have no empirical evidence to say that it works. And so I think that's an important thing to remember when you're deciding what to do clinically. If you want to do something that's evidence-based, that's empirically supported, you have to stick with something that's pure, or you have to do a study to find out, does it work the way that you're combining it together? So here's the reference for this article. So if you want to go find it, you can find it. Now, I hope that was helpful. All of that research basically comes down to, we know that solution-focused brief therapy is working. We know that it's working well across ages, across cultures, across various groups and presenting problems. And we can have a lot of confidence. We have a little bit of work to do on getting some more research out there. If you want to combine it with something else, you better go do some more research. But we know that solution-focused brief therapy is working, and it's working really well. So if you have to talk to people about the effectiveness of solution-focused brief therapy, this is a really helpful study to point to that will let you know lots of different areas in which it does work and why it's working. So please let me know what you think. I would love to hear your feedback. I just want to thank the authors of this study for doing some really rigorous, hard work and coming up with this umbrella review. It's really helpful for us to consider the overall worldwide research. And I'm really appreciative to them for putting this forward. So let me know what you think. Let me know what questions you've got, and we'll try to address them the best that we can.